Again, I just want to give a shout out to my wonderful medical team. It's ambulatory, behavioral health, dental, all out of this building, all together. You guys worked, and believe it or not, we did a lot of oral health telemedicine, which was kind of interesting. So Dr. Elena Kwiatkowski, our Chief Medical Director, led the charge. Couldn't do it without them. Right now, I'd like to introduce Jason Vila, who is our Assistant Medical Director. Jason has led the charge getting into communities of need. Jason.
Thank you so much, everyone. So my name is Jason Villa. I'm the Assistant Medical Director at CCAF Family Health Services. COVID-19 has disproportionately affected the community of color. Latinos, for example, are 3 to 4 times more likely to be infected, hospitalized, and die from COVID-19. Which is extremely unfortunate. A lot of the folks from the community of color are essential workers. And they had actually faced a lot of barriers for vaccination that we've been addressing here at CCAP. CCAP has been in the front line since the beginning of the pandemic and has carried out and expanded testing and vaccination programs to meet the needs of the community and to continue to address some of the health disparities. We are proud of our staff that continues to take the role on educating the community on the importance and safetiness of getting vaccinations. We are currently vaccinating our patients from the age of 18 to 64 with qualified medical records, qualified medical conditions, and patients 65 and above. Patients can make appointments at any point at 401-943-1981, but we are proud to be part of this team, which has continued to address some of the health disparities in the state and also to address in the country. Thank you.
And last but not least, our friend Merrill Thomas, President CEO of Providence Health Centers.
Thank you. I'm pinch hitting for Jane Hayward, President of the Rhode Island Health Center Association. Besides CCAP and Providence, there's 7 other health center organizations. We take care of 200,000, just under 200,000 of Rhode Island residents. That's 1/5 of the state population. So we really play a critical role, and I'm very proud from day one, we all committed last March we were not going to close. And so all you frontline workers, thank you for being out there. Every site, we stayed open. We had to be there for our patients, right? So we have over 34 access points in Rhode Island, and the community health centers continue to do every day something new. We went to telehealth, but we didn't close. And we kept even oral health and everything, optometry, that we kept going. So thank you, delegation. I can tell you today I have 6 new workers starting because of this money, and 24 more coming in the next 2 weeks. This money is going to immediate use. We are moving ahead and get those shots in arms. So the Providence Health Centers are fortunate to be part of a great group of other health centers, and we all each do what's needed in our own communities to address the needs of our patients. And so we know that there's disparity. We know that we are working hard every day to now get shots in arms, and we're excited for this funding to allow us to be more creative and to be more quick in doing it. So this money will go to immediate use, and thank you very much.
So thank you all. Secretary Jones joins us. Secretary Jones is the Secretary of UHHS. I'm not sure if you'd like to say a few words. You're good? Okay. Okay. She's going to come back for a tour, though. I promise that. Well, thank you, everyone, for coming, and thank you, God.
A question for you, or Jim, or Secretary Jones. I know the health department has made a point to put more vaccine in the hard-hit communities. What are the barriers you're talking about? How come there is a disparity in communities of color? What can you tell us about what you're seeing as to why they're not getting as good access to the vaccine?
Sure, and Secretary can answer that.
That's a wonderful question, and thank you for asking. I'm Woman's Jones, Secretary of EOHHS. What I would say, it's not about hesitancy, it's about access. And with access, you have to look at what you mean by that. If you set up centers with individuals with uniforms, weapons, some within our communities of color don't feel comfortable, whether they're not documented or are documented. It doesn't make, you don't feel comfortable. Also, you don't feel comfortable going out of your community. It's just, for many, some people have never, driven out of Woonsocket. They've never left different parts of the state. So it's about access and being honest about what access really means. But it's not hesitancy.
How do you think you fix that?
How do we fix it? We create in situations in communities of color and Black, Indigenous, people of color communities where they can easily register or register on site to be able to get a shot in their arm in their community where they feel safe.
How do you promote that?
Oh, I'm sorry.
Do you think the registration process itself is cumbersome and intimidating and not user friendly, and that's part of it as well?
For some individuals, that could be the case, that they don't feel that it's user friendly. I'll admit, I'm not technology really well educated, so I might have a struggle. So we need to do what we have to do to remove those barriers, but still to be able to have data to show what we're doing, because that data is important. We need to be able to track and know. So we need to look at, and Dr. Alexander Scott and her team are, ways to continue to make that system better or easier. And also when individuals even come to get their vaccine, not turning them away because they don't have an ID or a bill. You're a Rhode Islander. You need to get a shot. That's what we're emphasizing.
How do you promote it in the Latino community?
In terms of promotion, reaching out through all of the mediums and ways that not only we should, but we can, and creating additional ways to be able to properly broadcast and ensure that everyone knows in their own languages of choice, because it's not just Spanish. We have individuals with different dialects from different countries. So we have to, every single day, look at better ways to do that.
So we're adding translators, community health outreach, taxi rides, whatever it takes, whatever the barrier is. That's what we do. We break down those barriers to get the people.
Yeah, and maybe my next question. You talked about hiring more people. You talked about a mobile vaccination thing. What else can you use this?
So, we are hiring translators, nurses, community health outreach workers. We're expanding space, getting people taxi rides, calling on the phone, working down lists. This is not a passive, we're just waiting for people to come back. We are going out to get people and then break down any barriers that they have so that they can get in. So language is not an issue, transportation is not an issue, ID is not an issue. We're gonna get you in and get a shot. What we need is more doses. That's what we're waiting for, is more doses. So once the state starts getting more, we're ready to go. But I'm getting 100 doses a week. I'm sorry, that's not enough. So in the next 3 or 4 weeks, we think that's gonna start doubling and tripling. But I don't have enough doses, so that's what we're waiting for. But we're ready to go, and we'll break down the barriers.
I just wanted to recognize that Mayor Hopkins joined us. Poor Mayor Hopkins. So he comes on board and has to all of a sudden set up vaccine clinics. So we all joined forces. He's actually next door doing vaccine clinics. We're doing a drive-through here, and we're helping provide medical support to those clinics as well. So talk about baptism by fire. But it's nice to join forces in the city. So thank you. He didn't want
say
to,
a
but
few
go
words.
ahead.
Okay.
Just say thanks.
They just said throw me in, but thank you, thank you, thank you. My good friends here representing us from Washington, we're doing everything in our power here in Cranston to help everybody get these vaccines out. We're into week 6. We're on the second phase of the shots, and I can't thank you enough for giving us what you have given us. But like other speakers have said, give us the vaccines and we will get them out to the people of Cranston. So thank you so much. Thank you.